Good morning, Tony Maritato here. In today's video, I want to talk about using a TENS unit. Now, this is the TENS 3000 on Amazon. You can find a TENS 7000. This is probably the best unit that I've used in the clinic. We've used this for well over 20 years. It's affordable, it's easy to use, it's durable, it works for this kind of thing. So after a knee replacement, a lot of patients are dealing with increased swelling, increased pain, limited range of motion. This is not a cure for any of those things, but it does make movement a little more tolerable, especially if you're challenged with pain and discomfort while moving into flexion or extension. So let's talk about a couple ways to set up the TENS unit when I'm trying to work on flexion. Then we'll talk about how to set it up when I'm trying to work on extension to provide me a little bit of distraction from the pain sensation. So first, if I'm working on right knee range of motion, I'm gonna see what I can do here. The TENS unit typically comes with a 9-volt battery, which is placed in here. I set my settings. For me personally, I like my pulse width to be about 180. I like my pulse rate to be 70. When you look inside the case, you'll see those numbers. I leave it at a max time of 15 minutes because I'd rather have it on for 15 and off for 15 than run continuous for 30 or an indefinite amount of time. And then the mode is just normal. So my settings are set. Now, settings are unique to each individual, so don't feel like you have to do what I do simply because that's what I set it to. Get a feel for what it feels like. Now, we have a red and white lead on each side, each cable. What I'm gonna do is I'm gonna take these off of the plastic strip. I'm gonna take both electrodes from the same wire. I'm gonna set one above on the inside of the knee. It doesn't matter if it's the black or the red. And then I'm gonna set one down below. Now, when I do the one down below, I wanna be aware that I'm not on the fibular head. The fibula is the bone that runs up along the outside of the knee. I don't like putting electrodes on top of bony bumps or any bone that's close to the surface. So what I'm gonna do is I'm gonna go about 2 inches just below the fibular head, kind of more on the side of the calf. So there's probably about 10 inches, 12 inches of distance between the medial and lateral electrode. And then I'm gonna do the same thing on the other side. I'm gonna take one electrode, I'm gonna put it on inside my calf muscle. I'm gonna take the other one, I'm gonna put it above the knee on the outside, lateral quad, kind of down at the IT band. A lot of patients will comment that they have discomfort on the IT band. Sometimes a TENS unit like this might provide a little bit of relief. And so at this point, the unit is turned off. What I'm gonna do is I'm gonna open the lid, I'm gonna turn the unit on. Now, last time somebody was using this, they left it on, and so I had to turn it off, allow it to reset. Now I'm gonna turn it back on. And as I gradually go up, so right now I'm on 3, I can just start to feel a little bit of a buzzy, tingly sensation. I'm gonna go just a touch higher, right there. So I'm about 3.5. I can feel the 2 electrodes buzzing. It's a very comfortable sensation. My muscle is not twitching. There's no discomfort. There's no sharpness to it. Now I'm gonna turn on the other side. I'm gonna bring it up to match, about 3.5. There it is. And what I'm looking for really is what it feels like. The numbers on the machine don't really mean a whole lot. It's what do I feel? How intense does it feel? Is it comfortable? Assuming it's a comfortable level of intensity, I'm just gonna leave it like that because all this is doing is it's stimulating some of the superficial nerve endings to tell my brain, hey, there's something else going on. We're feeling something different, right? The brain is used to the throbbing, the aching, the soreness. Now all of a sudden there's a new sensation coming into the system and it's gonna distract the brain a little bit. There is something called a gate theory. The gate theory is that some sensations travel more quickly than other sensations. So if you had sensation coming to the brain that was perceived as pain, now we've got a new sensation coming in. The nerve endings can only carry one sensation at a time, so it's giving the brain new information. Okay, so once I'm in this position, there's a couple ways now that we can start to work on knee flexion. And this video is getting pretty long, so I'll probably do a separate video for knee extension. But basically what I'm gonna do is, I like to come under the thigh. I almost never push on the lower leg to try and improve bend. I come under the thigh, I lift the thigh as if I'm bringing my knee toward my chest, toward my shoulder. And what naturally happens is the leg will just kind of relax into that knee flex position. As it relaxes, I'm looking to feel a little bit of a stretch sensation on the front of the knee. The electric sensation is still buzzing pretty good. Once I get to a level where I feel the stretch, I feel a little pull, I don't feel pinching in the back of the knee. If you feel pinching in the back of the knee, one way you can relieve that is to put your thumbs behind the knee in this position, behind the upper calf muscle. And what you would do is you would push the shin bone forward to try and relieve some of that pinching sensation. It's a weird combination of you're trying to bend the knee, but at the same time you're trying to press the tibial head forward just to take away some pinching that might be happening behind the knee. You know, a Baker's cyst is real common behind the knee. Sometimes the back of the implant will pinch some of the soft tissue when you're bending the knee. There's lots of reasons why you might feel sensation in the back that's not particularly comfortable. But the goal is we want to feel a pull, a stretch, a tightness across the front. As this continues to do its job, you're probably going to start to notice that you don't feel the electricity as much. That's totally normal within the first 2 to 3 minutes. So then what I'm going to do is I'm going to turn it up just a little more. So right now I'm at about 4.5. Then I'll do the same thing on the other one. I'll go ahead and close that. I'll come under. I can either use my forearm for a little better leverage. I can use my hands again. And I'm just gonna continue to kind of pull the thigh up to my body, allowing the foot and the lower leg to just relax. If you've been in physical therapy, you've heard your therapist say, relax, 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 probably 100,000 times. That's the hardest part. Like if somebody performed surgery on my knee, my body would not want to relax, and I understand that. So the hardest thing is to try and get it to relax. Now, if you've got more than 90 degrees of flexion, I'm gonna show you a little trick. If you were doing this on the side of a bed, so your non-surgical leg might be on the floor, your surgical leg is up on the bed. One of my favorite ways, once I've got somebody beyond 90 degrees and they're willing to do it on the bed, is I would have you flip over. So in this position, my hips are forward. I'm nowhere near my end range of motion at 90 degrees. But as I start to lean back into it, I can start to apply that pressure at the end range of motion. Now from here, what you can do is once you get to about an intensity level of a 6 out of 10. So 0 is I feel no discomfort. A 6 is I'm aware of the discomfort, but it's not stopping me. I could probably go further. Once I get to that level, what I'm gonna do is I'm gonna push my feet down. Now what happens is by pushing my feet down, I'm tightening the quadricep. I'm taking some of the extension, some of the flexion away. I'm moving toward extension. But then when I relax, I can usually sit back a little further. And then from here, I would push down again. My thigh is tight. The top of my foot is pushing down into the mattress. I relax and I sit back into it. Typically when you're doing an exercise like this, you're gonna push for 5 to 7 seconds. You're gonna relax for 5 to 7 seconds. You're gonna repeat it 10 times. This is something that you could do multiple times while you're using the TENS unit. And again, I use the TENS unit for about 15 minutes at a time. I don't like using it longer than that because it loses its effect, it loses its benefit. When you're done, you can open it up, you can turn the electrodes off. If you think you're gonna have a second session 15 minutes later, just leave everything attached. If you're not, you always wanna be sure to keep your little plastic because you're gonna put these electrodes back on the plastic holder. That's gonna help maintain some of the stickiness so you don't have to buy new electrodes as often. You want to try to make sure that your skin is clean. You want to try not to have lotion or anything on the skin. That will help the electrodes last a little bit longer. It's not unreasonable that if you're using the electrodes on a daily basis, you're probably going to have to replace them once a week. If you're using them less frequently, you might replace them once a month. But replacement electrodes are not that expensive. If for some reason you can't get replacement electrodes, there are some gels and some different things you can put on them. Or if you can just put them on and then wrap, like a compression wrap, an ace wrap, elastic wrap, anything like that, to hold the electrodes against the skin, even if they're not sticky anymore. As long as they have that skin contact, you will still feel the benefit of a TENS unit. So guys, thank you so much for watching. If you have questions, just let me know. I'll catch you on the next video.